here with Dr. Kumar, and we are going to be speaking about the new treatment, EMSCULPT.
Hi, welcome to CüR Laser and Skin.
Thank you. So the reason I'm super excited about the EMSCULPT is because I do fitness competitions and I do intense training and dieting. And for me, getting my abs is comes towards the end, and they're only there for a certain time of period, and during my off season my body fat does get a little higher, so the fat cells are just minimized and just shrunk. But with the EMSCULPT, I was reading and Dr. Kumar was telling me that the results are more permanent, and the body fat in the area where you're getting treated goes down about 10 to 20%. So for me, that is amazing.
Really excited for you to check out the EMSCULPT device. It's amazing technology.
So what can you tell me about the EMSCULPT? What is it exactly?
So EMSCULPT uses magnetic energy to stimulate muscle contractions in the area being treated. And we can send energy into the abdominal area or the buttocks right now, are the two areas that are typically being treated.
Okay, and how many treatments does a person need?
A usual schedule involves 30-minute treatments lasting over 2 weeks, spaced 2 to 3 days apart.
So typically, when can a person start seeing results?
So you'll notice some improvement in posture and tone immediately after the first treatment. Then with each subsequent treatment over the 4 treatments, you'll notice improving strength and posture and tone. And then most people will notice sort of the more dramatic sort of contouring benefits within 2 to 4 weeks, and 6 weeks they'll continue to see improvement. In about 90 days, 3 months or so, 4 months, you'll notice the most sort of dramatic peak sort of results. But the muscle will, the fat will continue to break down for subsequent few weeks after that still.
Okay, great. And in terms of pain tolerance, is there pain?
Pain is not really the word used to describe for most people. You find a little bit of discomfort from the actual contractions. It's a strange sensation where the energy contracts your muscles and you're not consciously contracting them yourself.
Right.
So that's a bit of an unusual sensation. However, pain isn't quite the word people would use. It's a little bit uncomfortable. And most people, after the procedure has been done, they'll feel a mild amount of discomfort, if anything at all.
Okay. So what can a person do to prepare for this? Is there anything they need to do coming into the treatment and post-treatment?
Not really. You can, when you get the treatment done, we'll make sure that, because it's a magnetic device, we want to make sure that there isn't any metal in the area being treated. So we'll often ask you to, even if it'll get you to take off your jewelry or your watch, we won't let you have your iPhone in your hand. And people with metallic implants, or like pacemakers or joint prosthesis, then we can't do treatments on them.
Right. And I was also reading that, aesthetically, of course, it's going to get you the results, like a 6-pack or, a butt lift or whatever the person wants, but it also helps strengthen the core.
Exactly. The muscle is actually being stimulated. You are actually working out the muscles. The muscles are getting stronger, your core is getting stronger, and as the muscles are being strengthened, fat is being broken down.
Okay. So what kind of person is this treatment good for?
Almost anybody can benefit from it, and if you have even as long as you don't have more than a couple inches of fat for the magnetic energy to travel through to stimulate the muscle, then it'll still work on you. Although if you've got more than a couple inches of fat, then maybe you want to be working out, watching your diet, and reducing your calories that way. However, anybody would benefit from the device. You would still see improvement in the strengthening of the muscle and then the breaking down of the fat.
And then you were also telling me that this treatment can complement with another treatment.
Yes, so CoolSculpting is a device that we also offer here. We have CoolSculpting treatments, and CoolSculpting is good for any sort of pinchable fat. If you can pinch it with your fingers, then we can typically treat it with CoolSculpting. So you get a lot more. You can treat maybe 20 to 40% of the fat in an area with cool sculpting. And so for a lot of people to have enough fat, and that's a better treatment to do first. And as some of that fat's been taken away, then EMSCULPT can be brought in.
So, I mean, training at the gym, we can only do a certain amount of sit-ups during a session, but I was reading that this is almost like 20,000 sit-ups in one session.
Exactly.
Yeah.
It'll take you through, the device will take you through 20,000 contractions of the area, in the area being treated. And not just some of the muscles that you can contract when you're doing crunches with your, consciously doing your sit-ups. But this will take contractions through every muscle in the area, and it'll take it through 20,000 times.
Yeah, and I was looking at the pictures. I mean, of course, eating right and exercising is important and should be continued. But looking at the pictures, I can tell it takes a person who has like a toned stomach, and if they're having trouble getting those abs, it just kind of takes it to that next level.
Next level,
Yeah.
exactly. So when I do core work and I'm doing planks, I'm doing sit-ups, I'm doing crunches, I'm doing all these different kinds of exercises through my workout. But even then, there's only so much I can take my body through. And even the most elite of athletes can maybe do 20 to 30%. Contract about 20 to 30% of the full potential. But this will take through, the EMSCULPT will take your muscle contraction through 100% of that full potential.
And without actually having to restrict your calories so much, I guess it'll just help with that.
Sure, and restricting your calories will still, break, and that's over your overall body, but this targets that particular area. As the muscles are being contracted, they're being stimulated, there's a demand for energy by these muscles because they're working. So as they demand this energy, they grab that energy through the fat cells in the area. And those fat cells start to break down as the muscle grabs the energy from them. And so these fat cells then are destroyed.
So I'm going to be doing this treatment in my abdomen area, and I'm really looking forward to it, and I'm excited for you guys to see the results.
Is breaking down what do you figure out of 10 would you call the pain or discomfort?